Check 1, 2.
Well, hello there, boyfriend. How are you this fine day?
I'm really good.
Is it working?
Yes.
Excellent. Let's not touch shit.
I'm afraid to ask, but I have a great question.
I don't even know what I was going to say. I'm so disturbed right now. You get uncomfortable?
Of course I do.
Why do you get uncomfortable?
Because
I don't understand that.
I'll tell you the truth.
I don't understand that.
Because it feels like a mistake or a fault or something. Feels like a
Because you have discipline? That's what I don't understand. I see it as a positive.
Well, that's nice. So we're recording, by the way. I know. But we just got a question, and it got us talking about drinking. And I don't drink. Should I just play the? By the way, I got a little Topo Chico with lime.
Delicious.
This lawyer friend of mine, he was like, dude, you can't show brands of whatever. You have to put it in a glass, because what if they're like, hey, there could be advertising. And I was like, please, that will be such a quality problem.
So if you like Topo Chico, do you know what's on the front of it without looking? Because you drink it all the time.
It's hard not to look.
What is it?
It's from Mexico.
Good.
I would say it's a bull.
No.
What is it?
It's a woman.
Really?
So
what's she doing?
Well, the story goes that Montezuma's daughter could not go on any farther, so they carried her miles and miles and miles to this natural spring where she drank from it and then was okay. And that's where they say that the water is derived. And it should be a picture of a woman kneeling, drinking water, or scooping up water.
How did you know that?
I'm right. Am I not right?
You're right.
Yeah.
I have a question that is a kind of a medical question.
And by the way, I didn't research this right before the podcast.
No, you did not. Of course not. You had no idea.
You drink so many of them that I read up on it once because I was curious.
That's absolutely incredible.
Well, I thought it was interesting that it said imported from Mexico. And I'm like, why would you import something from Mexico? I mean, they have great products, but I just was curious why we would pay for something this far away from that country.
Yeah,
and because they're proud of.
I'm just checking, make sure we're recording. But you just demonstrated what a great person you are in this relationship. I feel like I should stop the podcast right now and read a thick book on Caesar salads, just to know where you're coming from, because that's what you eat every day. Question, medical. Have you ever heard someone say the joke, not a joke, but they call diarrhea Montezuma's revenge? Yeah. Is it because his daughter drank from that spring and it was not clean and he shit? And then why are we associating Montezuma with a delicious spring water if there's a diarrhea relate?
Well, that legend actually says that she was healthily improved. Okay. Montezuma's revenge, though, is Mexican traveler's diarrhea, which usually comes from a contaminant that you consume and have explosive diarrhea.
So that's not the jargon, or it is jargon?
Physicians will say that. I actually Yes, I had a board question on it. One of the board questions that I had last week when I took my boards, I'm not even kidding you.
Do you know?
Specifically had a patient that said that they just returned from a trip from Mexico, had explosive watery diarrhea. Okay. What was the treatment of choice? Okay. And the problem is we get clue words, right? Like explosive watery diarrhea usually means giardia, lamblia, specific pathogen, and you treat it with a specific medication. But then they try to throw you and they say Mexico, and you're like, well, Mexico is traveler's diarrhea, and that's an antibiotic.
That's the only kind I get is travelers, because I'm always traveling. I would never. I thought as you were talking to me that you were kind of doing a bit.
With what?
Just this whole thing that...
No.
That a physician... I thought you were saying a physician might say traveler's diarrhea, but I didn't think you meant they would say Montezuma's revenge. I do trust you. You never lie to me, but I did Google it while you were speaking.
Well, Montezuma's revenge is not something that would be in the boards, but saying someone went to Mexico and returned with diarrhea absolutely is. That's how we take medical questions. Doctors are actually taught to be quite judgmental in our thought process. We have to look for specific little clues.
When I brought it up, I almost felt like it was racist. I almost didn't say it because I was thinking is saying Montezuma's revenge, is that a racist thing? But I think it's one of those things that people do get this from the food and water in Mexico sometimes. Does it have to be Mexico?
It doesn't have to be Mexico.
Well, then I am that's why I made it.
But that's for my board question specifically did say this patient returned from Mexico with explosive watery diarrhea. Wow. So you had to know that traveler's diarrhea is associated with Mexico.
Gotcha.
Because some countries don't have great purification systems and their water does have a lot more contaminants.
Just to clarify, traveler's diarrhea is a smaller one that's nice, compact. You could put in your carry-on.
Sure.
Like a traveler's toothpaste.
Yeah.
The traveler's diarrhea, not the most comfortable. You know why? Inherent in the name, you're using a stranger's toilet.
No, the worst. You're traveling. A lot of the times,
That's
people
what I'm
don't get sick. I mean, they might get sick. You pray to God. It's almost like, would you want to get sick at the beginning of your vacation or at the end if you had to pick one? I would want the beginning. You know what? Because you're on an airplane shitting your pants.
I'm so sorry. I thought you meant like we're going somewhere for a week. Do I want to get sick on day 1 or day 7?
Well, of
Let
course
me get
day
sick
7.
on the way home.
So, but you got to think though. Do you really want to be? I was on an airplane back from Hawaii, and while we were boarding, a little girl had diarrhea. And the mom caught it and just went all over the ground.
Dear Lord.
And they still went on the plane, and then she's throwing up and having diarrhea in the back of the plane. I would think that they wouldn't allow someone on like that. And then guess what happens? I come home. Guess who caught it? My dad got it. I got it. Vomiting and diarrhea from exposure on the plane.
Wow.
But like, can you imagine being that ill on an airplane? That has to be a terrible feeling.
But I thought you just said you wanted to be ill on the airplane.
No. I would prefer the beginning of the vacation, like after I arrive there, so I can be in a hotel room at least shitting. Yes, I would miss the opportunity of a nice vacation, but I just consider it to be terrifying to have explosive diarrhea on an airplane toilet.
But why wouldn't you want, because I thought you were saying beginning or end of a vacation. Why wouldn't you want it at the end? Because
then at the end, like the last day of your vacation, then you get on a plane and you're shitting all day. I'm saying like it's not just like a 10-second interval. Like if you're going to be sick for a couple of days. Well, that's what happened to people with COVID. When COVID first happened, remember all the people who would like test positive and they were stuck on vacation?
Yeah.
Well, if you're really sick, you can't travel anyway. It's better to rest.
Right.
But then there were people who were complaining that they were healthy. They had no symptoms, but they were quarantined on like a cruise ship because they all tested positive. And they were stuck in this tiny little isolated room because the cruise ships wouldn't let them go to the main area. I feel like that would be miserable.
I was fucking dying to be... What COVID was I... Okay, let me say it this way. I did at one point do cruise ships. I did comedy on cruise ships.
Yeah.
And I talked to friends of mine who were like, please God, let there be a corona outbreak on my cruise ship, because they would then be isolated in their rooms and they wouldn't have to do shows and they were getting just paid all their money.
So
that's how tough cruise ship comedy is, Erika.
Are you being serious though?
Oh, yeah.
But not with COVID. You're talking about other coronaviruses.
I'm talking with corona. COVID specifically. I know a guy who was shooting a movie. And he was a photographer, and he was getting the highest day rate he's ever gotten. He was getting like $3,000 to $5,000 a day to shoot this movie. Corona, stuck in a beautiful hotel, 5-star hotel. I think it was $3,000 a day. They brought him food every day, and he was there for 2 weeks. And he was like, "This rules."
I mean, that's making the silver lining really shine through. You feel bad for the people who really do get sick with COVID, though, and obviously the mortality and morbidity of it all. But yeah, if you're healthy and you just test positive and you're asymptomatic, why not enjoy the benefits?
Yeah.
Well, so coronavirus existed for a long, long, long time. There's multiple strains. COVID is just one of them, right? Norovirus is the cruise ship one, though.
Norovirus. Norovirus.
Yeah. So that's like the cruise ship buffets, or like everybody on the cruise ship starts just getting like wickedly ill.
Yeah.
I don't ever want to go. Did you ever get sick on a cruise ship?
No, I don't get sick very often.
Why would you say that?
I've gotten motion sick.
We're on vacation right now. You're going to get fucking sick now. You just jinxed it. I fully believe in that.
I was walking.
God smacked yourself.
I've gotten motion sickness.
That doesn't count.
You've said to me several times, don't jinx yourself. Do you know it's never happened? I've said, like, I never get sick. This never happens to me. And you go, don't say that. But so far, so good.
Well, I did think it was interesting when, remember we ate those tacos that got recalled? And you had like stomach pain, but I was like on the ground, like throwing up.
For context, I get an email. And as I'm reading the email, my phone rings. Don't answer it because it's a strange number.
Yeah.
And I send it to voicemail, and the email says, "Dear Jamie, it shows that you purchased these tacos from Costco," which I almost feel like just that alone means I deserve to be sick, that I bought tacos from Costco. Can I jump in and not? Oh, you got that? You're just Erika's trying to open up Vita coconut water, and I wanted to do it because it makes me feel good when I do little things like that.
We really are branding stuff today. What else can we put on here?
I don't know. Costco. I just Costco'd. So I got an email from Costco, and they go, we noticed that you bought this taco thing, and turns out it has some kind of like, do you remember what it was? I could look it up. I got the email. It said some kind of virus. It was a legit scary virus. But then I go, I don't think anything of it. I think I barely read it.
Was it listeria?
It was listeria. Isn't that where the didn't that one show where what was that show all women liked and men didn't like? Didn't they live on Listeria Lane?
Wisteria.
What show is it?
Desperate Housewives?
Desperate Housewives.
Was it? Am I right?
Yes.
I think I watched one of those episodes just because Jesse Metcalf was supposed to be like hot as hell.
Was that a woman or a guy?
A dude. He was like 20 years old. I think he was like the pool boy or something.
Oh, that's right, the pool boy.
I didn't end up watching the show.
Yeah, he was hot. Our records indicate that you or one of your members purchased item 11545 Chicken Street Taco Kit from our service deli between January 25th, 2024, February 6th. This company has issued a voluntary recall of the cilantro lime sauce, which we dumped over all of the tacos.
It was good.
It was so good. I don't know what it was like. Something was in it. Like I don't know if it was the listeria.
Yeah. I think that sauce was like swimming. It was moving.
They recalled it out of an abundance of caution due to the potential listeria monocytogenes. Monocytogenes contamination. Listeria is an organism that can cause serious or sometimes fatal infections in young children, but is also spicy and delicious when used in conjunction with tacos. For other elderly people and individuals with weakened immune systems.
Well, it's very dangerous
caution.
for pregnant women because it can impact the fetus.
Damn.
So like you're not supposed to eat
Miscarriages, stillbirths.
That's what I just said.
I'm reading it to say like you're so right.
Of course I'm right. I'm a doctor.
I'm sorry to doubt
Jamie.
you today. It's not you.
So it's
me.
like frozen yogurt machines aren't cleaned very well. So you worry about listeria for pregnant women.
Yeah.
So they should have like scooped ice cream, like cold ice cream from a like Baskin Robbins or something, not from a yogurt machine.
Can I state the obvious? Just how hard is it? Isn't it the hardest thing in the world to be pregnant? Like, for goodness sake, not only are you growing a human being, just all the limitations. You're not allowed to drink. You could something terrible. There's just so many different things. You could physically, you have to be careful. You hear about I mean, it's just such a terrible, and then not terrible, but it's just such a tough, challenging thing. That
I think it's difficult that so many women feel like they're just a vessel and they're treated like you don't matter. Like you're told if you have pain, you can take Tylenol and nothing else. Mm-hmm. And like all your medication, you can't sleep, fucking deal with it. You want to eat this, you can't. Do you have a cat? You can't scoop his litter box anymore. You have to find someone else to take care of your cat.
That to me seems like the only positive.
Well,
right?
I think the problem is you lose your autonomy. It's like you're caring for this child that you love, that you want to take care of.
You imagine you love.
But like you're still living and this thing is inside
you're
of you.
You're a person too.
But you're not treated like one. I think that's what's really difficult. I didn't understand that until I became pregnant, how much people treat women like shit when they're pregnant. Like they're second class citizens.
Who treats women like shit?
Even the medical community.
Oh.
If there's anything wrong with them, it's like, you got to protect the baby. But what I've had to tell a lot of patients, especially patients who are struggling with severe depression, suicidality, well, we have to treat you because if you don't survive, your baby won't survive.
It's like put your airbag on before you put it on your kid.
That's the only time that they listen. But it's so sad that they feel like they can't even take a medication for their mental health because it would affect the baby. But if you're struggling severely and you're not taking care of your health in general, the fetus will suffer. So I think we need to spin it in much more of an open, non-judgmental tone.
Well, yeah.
Because a lot of people are afraid to ask for help.
I'm not a doctor, but I'll always say like, hey, let's wear a condom.
What the fuck?
Let's avoid this whole thing.
Where did that come from?
I'm just saying that we wouldn't even get to this point.
You
wouldn't be pregnant. No, you make a great point. I did not know that. I don't think a lot of guys know that we haven't been pregnant. I had no idea. I would have thought you had got first class treatment from medical professionals.
Nope, and you should get it from your spouse. But did you know the rates of domestic violence and physical abuse exponentially increase in a partnership when the woman is pregnant?
It's absolutely atrocious. How's that possible?
Horrible?
I was with a pregnant woman who was my wife at the time, and that's the craziest thing in the world.
You would think that they would be doted on and treated well. Yeah, it's sad.
Well, that's not right. I kind of want to get you pregnant just to show you how you should have been treated.
Get the fuck away from me.
Just to show you how you should be treated. I don't know
that is like the worst thing.
Sometimes I start a joke and you finish it and I wish I hadn't started it. That was one of those examples. Just the disgust, the terror.
Yeah, you can keep every part of you away from every part of me for a while.
Especially I should be treated. Hey.
Ew. Jamie?
It's so weird. We started this podcast. I have two things to say. You have a lot of beverages. We started this with Topo Chico. You're drinking a Vita Coco coconut water. You also have, what do you got here? Erika, what do you
Well, speaking of
magnesium
Montezuma's
citrate.
Revenge.
What is that? Just like something that hydrates you?
Magnesium citrate is, well, a laxative.
Shit water?
I hope that it induces shit water. So I have irritable bowel syndrome. Pretty significant.
IBS.
Yeah. And when I travel, and we're in high altitude right now, we're in the mountains.
Traveler's IBS.
Traveler's IBS. I have traveler's non-diarrhea.
You wish you had traveler's diarrhea.
I would love to have traveler's diarrhea.
Yeah.
But like a mild case.
You wish it was Montezuma's, like he moved first. It wasn't even revenge. You wish it was Montezuma's strike. Like that would help you. I worry. I know we're making. I get worried about you because people have died from
bowel obstructions.
Bowel obstruction.
Yeah, small bowel obstructions are dangerous. They can perforate your intestines, and it's very painful.
It's not good.
So when I travel, especially on flights, and then I'm in high altitude, I get dehydrated, I get headaches.
We're in Reno,
I do
Nevada.
Get altitude sickness.
Reno, Nevada. What is the altitude?
It was 4,000 something.
Yeah. So, what's Denver, like 5?
Yeah.
So this is legit altitude.
Denver's 5 something. I looked up last night.
So sorry to interrupt you, but are you having altitude sickness, or is this is it a combo platter?
I would say both. So I'm severely dehydrated. Now, I intentionally dehydrate myself on the planes. We've talked about this.
Yeah.
I hate airplane bathrooms. I find them to be just absolutely atrociously disgusting. So I would rather be just parched and not pee all day than have to go to the bathroom. See why I was terrified of having diarrhea on an airplane? I don't want to go in there. I think they're nasty.
Do you know nothing bothers me? Like stuff doesn't gross me out like that. Like I'll use an outhouse or whatever.
Ew.
The airplane bathroom, you're absolutely right. There's no one going in there to service the bathroom during the flight. An airplane bathroom on hour 3 of a 4-hour flight, there's sometimes papers on the ground.
It's sticky. You stepped in pee.
Yeah, and it sometimes doesn't go all the way down. It's not. It's an imperfect system. The airplane.
Well, what bothers me is that they're so small that when you turn around, your legs touch the toilet often. I try not to. Or like your whole body touches stuff, and it just grosses me out. It's like the bathroom stalls in like a public bathroom where they're so small and the doors open inward. You have to like put yourself against like the toilet, and I get so mad. All right. So that being said, I intentionally dehydrate myself so I don't have to pee. So I don't drink any water usually the day I have a flight. And then whenever I land, I chug water. So I'm dehydrated. I'm trying to replenish it. So I have the coconut water with electrolytes. Yes, it has a lot of sugar, but it's going to replace the other things that I want. And I'm drinking magnesium citrate to induce a bowel movement because I get what they call traveler's bloat. Or airplane bloat. Mm-hmm. Oftentimes with the compressive forces and higher altitudes in flying, you can have worsened constipation, gas, bloating, loss of GI motility, essentially. So I'm hoping that this will work, but I'm scared to drink it because I've actually never tried it before. And I have to drink the whole bottle.
Best thing about this hotel room we're in?
2 bathrooms.
That's right. It's a 2 bathroom.
That's why our relationship is saved.
I do feel like...
All right, I'm going to drink some because I actually want to get the ball rolling.
Can I say something? And I'll
it says it might make me poop in a half an hour. It might make me poop in 6 hours. That's a big window.
Is this an inexpensive one? We paid more for a smaller range? Is it like when you order Instacart and for $3 more they go, would you like
Express
a delivery?
No,
the delivery window.
Well, I don't know. I got to drink it. You got a show tonight, and I'm going to probably, for anyone at the show in Reno tonight, if they see me run out, they'll know why.
So a half hour to 6 hours, so that's like between 1 p.m. and 7 p.m.
I'm fucked.
It's just a very, very long range.
The show's at 7:30. All right, hold my microphone. Here
you know
I go.
You know what has a better range?
Hold this for a sec, please.
I've seen better ranges when people say they're going to come fix your internet. They go, we're showing up between noon and 6. It's a better range than your shit water.
Have you drank this before?
Yeah, you want to hear a quick story?
Yeah.
Comedians don't have health insurance for the most part.
Is this going to taste good or bad?
I found it to be neutral.
You know what's interesting? I have given this to so many patients, but I've never tried it. It's like, I don't know, what would the analogy be? The comparison of like, do what I say, not as I do. Do as I do. Well, I'm doing what I tell people to do.
Not to call you on something, but wouldn't you also not recommend to a patient to dehydrate themselves on an airplane?
Yes, what I do is terrible.
Isn't that kind of funny?
Okay, but airplane bathrooms are gross.
Yeah. But if your patient came in and said, like, I'm going on a 6-hour flight, I'm not going to drink.
I would tell them to not ever do what I do.
Interesting.
Now, the other thing is, did you know that you have to be careful of laxatives? If you drink too much, you can get a problem with your colon.
Seems to make sense.
You can get black spots on the inside of your colon.
I wouldn't think it would be great to drink a bunch of laxatives.
Well, people abuse it if they have like body dysmorphia and like eating disorders.
We just were at Walgreens purchasing that, and what's really interesting is there are a bunch of young guys. Don't say. It's not good.
Fuck.
Don't you think it's weird what happened to Walgreens? I'm going to distract you. At Walgreens,
it's so sour.
I don't know if I had that.
Is there citric acid in it? It must be if it says magnesium citrate. What else is there? Sodium. Cherry flavored. It doesn't taste like cherry. Alcohol content. Woo! I'm getting fucked up in Reno.
People love to get fucked up.
Guess how much alcohol is in this?
0.5%.
0.005, which I'm surprised they have to put that on the bottle.
Is that a big difference, the 0.00? I'm just kidding. It's a huge difference. Wasn't it weird that we went to Walgreens, Erika? And there were these guys.
It was so funny.
They were the only people in the entire Walgreens was us and these 5 men who were all together, these young boys. One of them was a girl. And we walk in, it's like the only people we see in Walgreens. And it was almost like you guys both reached for the bottle of that Celtrate at the same time. Right? Do you remember this?
Yeah.
At the same exact time. But they were young guys, so I was thinking.
They were so cute. They looked like they were like 20. I was like, why is he having a hard time pooping?
And he was, we figured it out. We were like, he's trying to make weight.
Yeah, because we saw a bunch of other, well, they were carrying those big water bottles. And he was talking about like, okay, I got to buy this. And then where's the Imodium? Because I got to buy that afterwards.
I oftentimes, no joke, wonder if wrestling in high school to me gave me a super fucked up body weird image, losing weight, because we would lose this weight to make weight, and then we would not eat or drink anything, like not even water, and then the day of the match you make weight and then you can eat before the match. We would go to this donut place and eat a bunch of donuts and stuff. It had to be so terrible for us. And I have I'm a bit of a weird eater.
You're a healthy eater now. Well,
but it's strange.
But you have a very atypical pattern.
What do you mean?
Of your intermittent fasting, where you've trained your body to like only eat one meal a day. So many people struggle with that, even though it's great. And I try. Sometimes I can't. I'm so hungry.
But this goes back to why I don't drink one drink.
They're coming for me.
A night? Oh, the ambulance. Do you want to go grab that?
Well, I already drank a third of it. They know that I'm going to need them soon.
Reno, not the healthiest people. When you go on Uber, you can get an ambulance if you want. It's one of the options. But yeah, I think that my fasting, I think
it's just, never mind.
My fasting is a symptom of my sometimes. I'm very good with self-control, not good with moderation. And so like it's so easy for me. If you gave me frosting right now, I'd eat frosting every day for the next 3. I don't want to. I have a show tonight.
Taste it. You're not going to poop if you lick it.
Can we
seriously, what is going on?
That's really fucking bad. I'm sorry.
I got to drink the whole bottle.
So, would you mind if I right before the show, we had a bunch of questions come in and then we got a little bit distracted. Oh, quick story. I told you I was going to tell you.
What?
I had a really bad stomach problem once.
Oh.
And I called my sister who's a nurse and she said, call me back in an hour if it's not any better. And like, I don't think I'm a complainer. Would you say? And it hurt. I was on an airplane and I was actually going, I was like making noises. It hurt so much, right? And so I call my sister on a layover in Chicago and I go, yeah, my stomach hurts so much. And she's like, why don't you give it a little while and call me back if it's still bad. And an hour later I was doubled over in pain. What would you say? She said, you have to skip your flight and go to the hospital.
I would ask you the location of your pain.
I think it was like left. She asked me that and didn't like the answer. Whatever I said, she said, I'd like you to go, I'm sorry. And she goes, it's probably going to cost you thousands of dollars because you don't have any health insurance, but like you can't not go to the hospital. Like it's what, I don't know if it was in my, what's over here? Pancreas, spleen, heart? What's down here?
Heart?
I'm just kidding.
All right, right upper quadrant. Let's go. Right upper quadrant. Your right upper. Your upper. What's there?
Spleen, liver.
Liver and?
Lung?
Gallbladder. Mid-epigastric region.
I think that's what she was saying.
So mid-epigastric, go over. What do you think's there?
Upper abs?
pancreas.
Okay.
Left upper quadrant.
Left upper spleen?
Yes, good job. Left lower quadrant.
Balls? Too low.
No.
I don't know. Appendix.
No. So for a man, it's just colon. It's your sigmoid colon. It's the last part before you poop.
Trick
It's the
question.
most common place for diverticulitis, diverticulosis, toxic megacolon, things where, like, if you're having bowel obstructions problems, we worry about it's your bowels mostly.
Is that like toxic masculinity? Is it similar?
No.
Toxic
And then-
megacolon?
No. And then for women, ovary. Mm-hmm. And then right lower quadrant.
Right lower quadrant? Something
It's called
is there.
McBurney's point. If you go from your ASIS, your anterior superior iliac
McBurney?
spine,
He was a sick
and
fuck,
then
that
your
guy.
umbilicus, your belly button,
Okay.
it's 1/3 of the way from one, 2/3 of the way from the other one is your
I don't know.
appendix.
Damn.
But do you see how complicated it is just to know that?
Yeah. Already forgotten it.
Then guess what else? Some people can have a rotation
Yeah.
where shit is not on the right side like it's supposed to be and it's on the left.
So crazy.
So for us, it's, okay, where was your pain? You pointed up here. So that's like spleen.
I don't remember.
Oh.
I remember it was definitely my stomach, left or right.
Yeah.
But I remember her saying, like, that's a bad area wherever it was. You must please go to the hospital. She was like, I'll pay for it. Like, I remember I didn't have a lot of money. I remember her going, like, you have to just go. Because I was like, I can't do this.
I wonder if it was right lower then. Because that's like the emergency we worry about, appendicitis.
Might have been right lower.
Okay.
Because you got to get appendicitis, you could die if it bursts.
If it ruptures, you're in trouble.
So check this out, Dr. Erika.
Oh boy.
Do you know how hard it is for someone with no money? And I'm not kidding. I was making $250 to $300 a week as an MC doing stand-up comedy. And sometimes I didn't work every week. So this is like, I don't have a lot of money. And I'm like, fuck, dude, I want to just like ride this out. But my sister, who I don't think would overreact and loves me, says you have to do this. So I get in a taxi. I go to a hospital emergency room. The taxi was $50, and I remember that being a really big deal. Spending $50. I remember being like, shit, dude, $50. God, like that's how much that meant to me, that money. And so I went to the hospital, and they did what I think you physicians call. How much you got left? Do you want to wait? It's disgusting. So they did what I believe to be a battery of tests. Is that what you call it? What would you do if I came in and said that hurt?
$1 million workup.
They did everything. They did.
I would do blood work.
They did blood work.
Well, you slap on vital stuff, right? So we make sure that your heart rate, your blood pressure, your oxygen, your temperature are fine. And they probably put leads on you to monitor your heart. Mm-hmm. And then we would do blood work, necessary stuff, checking for like a CMP, so complete metabolic panel, electrolytes, liver and kidney function, lipase, that's for your pancreas. Probably did a urine test, make sure you didn't have a UTI, because occasionally even men can have pain in their abdomen. And then they're going to do imaging. And typical imaging is, so ultrasound is preferred for some stuff because it's non-radiation, it's non-invasive. It's fast and it's cheap, but it can miss a lot of appendicitis. So if you want to see appendicitis specifically, yeah.
Is it an MRI?
No.
Oh, fuck.
CAT scan. CT.
That's what they gave me, a CAT scan.
So that's a lot of radiation, but that's necessary because an ultrasound misses a lot of stuff. So actually, medically, we typically recommend a clinical diagnosis. Based on the location, based on your symptomatology, if you have a clear-cut case of appendicitis, it's a surgical consultation. The surgeon comes in, and they just cut open and look. They don't waste time with a CT.
Wow. You know my favorite part? Urine sample. I go, you can have as many as you want. Please come back in an hour. I'll give you another one. Because I had to pee the whole time. The only reason I know that there was a CAT scan, am I interrupting you?
No.
The only reason I know there was a CAT scan, and I remember everything specifically, because it was like a blur that day, was from the bill. Because I remember like looking at it and seeing like CAT scan was like $3,000. They did everything. They did all this blood work. And I was there for 4 hours. And they go, we don't know what it is. We don't know what it is. I'm getting nervous. I might have called my mom. I think I called my sister. She was nervous. A doctor comes in, like a very professional looking doctor, surgeon looking man. And he leans over to me and he whispers, hey man, like, how are you feeling? And I go, it still really hurts. And he goes, listen, you're going to be okay. He goes, you just have it's just a, and I don't remember the exact words. I wish I would love to remember the exact words, but it didn't make sense to me as a layman.
Fecal impaction.
He goes, you have like fecal impaction. which was one of my favorite bands in high school.
It's the nice way of saying you're full of shit.
So that's what happens. Erika, I know you're joking, but this is exactly what happens. He goes, you have fecal impaction. And I think to myself, okay, he just said I was going to be okay, but that still sounds serious. And then he goes, I'm going to give you these prescriptions. And I might have even gone, what does that mean? And he basically said what you just said. He goes, you have to shit, which is, I could see that being kind of funny to someone with health insurance. And so I'm looking at him and I'm thinking, I fought so hard to not come here. I just had a CAT scan. And he goes...
And radiation exposure.
Radiation exposure. Lots of urine samples, which I liked. But he goes, here's a couple prescriptions. And in my mind, I think to myself, at least I paid all this money, but I got these prescriptions, right?
Uh-oh.
Question for you. I take another friggin' $40 taxi to Walgreens.
Yeah.
I go to the pharmacist and I give her my prescription. I go, hey, I'm supposed to pick these up. Did they call them in? She looks at them and she says, what?
They're over the counter?
She goes, these aren't prescriptions. These are just things you buy in Walgreens.
Yep.
And I bought, I think this, magnesium citrate. And I went home and I pooped and I was fine. It was so embarrassing. It was very, very expensive and very embarrassing.
So...
$5,000.
Yeah, and that's so unfortunate. The problem is you don't know what's life-threatening and what isn't.
Right.
And even as a doctor, like, did I not tell you, like, I have a partial obstruction the last few days?
You did. I've been worried sick.
So the problem is we go to, like, the scariest stuff and the benign stuff and all the in-betweens based on our training. But you don't know that as someone who hasn't gone to medical school. You just know your pain. And then it's atypical. And you're like, oh, my gosh, do I go in or not? Can I wait this out?
And my sister,
so it's probably scary.
My sister, who has the training of a nurse, is thinking what you said, which is like, if you have this pain, there's a range of things it could be. Mm-hmm. But in that range, there's a person or two where it's something very serious. It could be appendicitis.
Well, and that's the hard thing. A lot of patients come in and they'll say, I have all of these like very vague complaints.
Yeah.
And I tell them, all right, I think it's nothing. We can do a bunch of labs that's not invasive. They're probably going to come back normal though. And are you okay with that? However, if you're really worried, we can do a couple cardiac tests. If you're the 1 in a million who has some weird arrhythmia that I miss, that's bad on me. So how about we do it? It's going to be time and money, but how about we do it to reassure you? And sometimes we agree that it's the best case scenario, but sometimes, I mean, it's also difficult. It's a guessing game, right? I don't have a magic ball, so I have to use my education to say, should this patient have $1 million workup, or should I just do the basic stuff, rule out the scary stuff, and if it gets worse, we'll do it.
Which isn't it bizarre?
Because you can't order every test on every single patient. We wouldn't have enough EKG machines and CAT scans to do them on everybody.
Right? And isn't it crazy that it can at some point come down to money? Like if I don't have insurance and I go, I don't want all this
very
tests,
difficult for me,
which is bullshit, because like it's your health. Why should it matter? Like in this case, I was like, man, someone told me I could die, I must spend all the money. But if I was with you and you were telling me that, I would say no, thank you very much, I appreciate it, but no
this
way.
also goes into like preventive care, and so many people are like, well, I'm really healthy, I don't need to see a doctor. Why we recommend wellness examinations occasionally, not so much a physical, more so the blood work is helpful for me, or like screening for blood pressure issues.
Yeah.
Because I've had patients come in who have said, well, I felt fine, so I didn't see a doctor in 30 years. And they have, unfortunately, overt metastatic prostate cancer. I had a gentleman come in with that. And he's like, well, I didn't have health insurance, so I skipped seeing the doctor for like 20, 30 years.
Yeah.
And then suddenly I had this back pain, so I came to see you, and it was because the cancer had spread to his back. But had he come in way before with a family history of prostate cancer with urinary symptoms, I would have tested, we would have found it, potentially we could have treated it and removed it before it spread. And it came down to money for him. And that's a case that I'll never forget. I was a third-year medical student when I had him, and some patients you never forget.
Want to hear a story that you're going to think it's a joke?
What?
It's true. Swearing to God that this is not a joke. I went and got a physical once by a doctor who was a guy.
Okay.
And I had seen him a couple times, probably a couple years in a row. And I always thought it was like a weird... I just didn't love it. I remember getting in your underwear was always weird, whatever. And no matter what I say, you're going to be like, that's a joke. And then when we turn off the recorder, you're going to go, there's no way that's true. And so I would always leave the physical place and be like, God, I fucking hate this going in there with this guy, whatever. And I was at school and we were at the lunchroom and I go, I hate getting a physical. And my friends, I'm talking like 7th grade or something, right? And my friends go, it's not that big a deal. What's the big deal? And I go, I just don't like when he snaps your underwear and slaps you in the ass at the end. And they go, what?
What a pervert.
Do you know I'm not? It sounds like a joke. He would snap my underwear and go like, good job. And I go, God, I hate the snap, kind of hurts. I go, does the snap hurt you guys? And they were all just like, the snap? Isn't that kind of crazy?
You know what? Well, first of all, pervert, he probably did other inappropriate things as well. Not to you, but maybe to other patients. So I don't like that story. Don't you think?
It didn't feel like inappropriate for sure. But it didn't feel like he was trying to touch me or anything.
Well, he did touch you.
Yeah.
He slapped you on the ass.
He did. But
so
it felt
like touching.
But it felt like a good job kind of slap, right?
No.
Do you know that your hand in an ass, the less amount of time it's there, the more it's a good job, and the less it's like, I would like this to lead to more?
What would you do if a random person downstairs in the casino right now slapped me on the ass and said, good job?
I'd fucking lose my shit on that person.
Even if it was a 1-second contact?
Yeah, you're right. Sorry.
I think this brings up a really good point, and I have nowhere to go on this, so I hope you have a story, because I don't. But how many things we do that we think are normal that everyone else thinks is abnormal?
That's why I brought it up. Like, I always wonder, this is a terrible thing to bring up, but do you ever think that, like, kids that are, like, like kids that, like, have to live, they are shackled or something? Or, like, there's been kids that, like, lived in cages and went to school. And then one day we're like, man, how big's your cage? And the other kid was like, what?
Well, that's a sad example. I was hoping you'd give me like a funny one of like you using like Kleenex all the time to wipe yourself after you pee instead of toilet paper or something.
I got one. Do you know until I was 30 years old, I didn't know you're supposed to come with someone else in the room?
That's disgusting.
I thought.
I wanted a real one. That's gross. You just tried to do a joke. I wanted a real story.
I thought you were supposed to be alone.
I almost feel like we need to like... at some point today, think about these and come up with them and like re-record it, because I bet you there's some really good ones.
Things that
you did
in your life. Well, look at every that
like other people didn't do. Like and maybe it's not your fault. Like you're raised a certain way, and your parents never teach you. I didn't know you had to change your underwear every day.
That's a great one.
But I was like 7, I think, when my mom told me.
And then I don't want to ask you, it's not polite to ask a woman her age, so I won't say. But now, what age did you start just not wearing it? How did you...
I was nervous that this medicine would like kick in and I'd have to run out of here and poop. But now I'm like waiting for the excuse just to run away from you.
How did you find out you're supposed to change your underwear every day?
She told me. She did laundry and she was like, hey, I haven't washed your underwear a lot lately. And I was like, what do you mean? They're not dirty. They weren't dirty. Like I was a tomboy when I was a little kid. So I would be like covered in mud, playing with worms, fishing, like just like out in nature, right?
Yeah.
So my pants would be like super muddy. So I'd throw them in the wash. But my underwear, there was nothing, like I was a little kid, like I'm not doing anything. So like they weren't dirty. So I'd wear them a second day or third day. And then she was like, that's bad. Now I'm like, oh, that's filthy. What was wrong with me? But when you're 7 and your shirt gets dirty, your pants get dirty, you change them. But I didn't know underwear. I thought...
I'm not trying to be a jerk here, but don't you tell... Like I tell my kid, I go, hey, you got to change. I give him a new pair. Were you in charge of your own clothes?
Yeah, I would dress myself.
Because my kid, I don't know if he would know.
I don't think it went for very long. Gotcha. But when she caught it, she was like, hey, Erika, like maybe we should... change your underwear. And I was like, what do you mean they're not dirty?
Wow. True story. I'm in college, not even 7 years old, with a good excuse. And my friend says to me, just not judging, but how often do you wash your sheets? And
I was just going to say that one. I was just thinking that.
And I mean, no idea that was even a thing. I was like, wash your... I didn't even know. I thought those were part of the mattress. I didn't even know they came off.
What do you think the appropriate response is?
That you're supposed to wash them?
Yeah.
I mean, for like once a week or something?
I think that's what it is. I don't know for sure, but I think that's what's recommended.
I washed them once a semester maximum.
Yeah.
Maximum.
Well, I mean,
but I was getting a lot of action back
but you're
then,
also
and I
supposed to
didn't-
change your pillows out after so long because of
Yeah.
like dust mites, which is nasty.
I changed it. By the way, I know I said I was getting a lot of action. I don't want you to get jealous. This was before I was 30, so I was.
Did you know there's
still
rules on how
coming
long you
along.
should change your toothbrush?
Yeah, I change my toothbrush all the time.
Google it.
I change all the time.
Google it, because I don't really know.
I thought it was like every couple of months. It's also kind of thing where why are we using our toothbrush for years when there's like $2, right? Do you know what I mean? Of all the things that are expensive to change, like a razor.
I don't know. What's it say? Oh, hold on. I want to guess before you. I'm going to go 30 days.
Okay.
What do you think?
I would say 2 weeks.
No, that's too short.
Do you think? 2 to 3 months.
Oh,
We recommend you replace your toothbrush every 2 to 3
2
months.
to 3 months.
Or as you notice wear and tear. How the fuck aggressively are you snapping your toothbrush in half?
What does it say for sheets? A week? I think it's a week.
Ooh, how often change sheets? God, isn't it crazy how dirty things were in college that we just let... I stayed in an apartment
Oh my
that if I
gosh.
brought you over to, you would be like, what is this shit? What is
I lived
happening?
in a fraternity house. I didn't even live in my sorority house.
That's disgusting for many
So
reasons.
gross. So gross.
How often should sheets be washed?
Weekly.
Every 2 weeks.
2 weeks.
And it mentions the aforementioned dust mites and bacteria you had
Oh,
mentioned.
yeah. Pillow. How often should you throw away your pillow?
How often? Pillow?
3 years.
I'm going to say a year. 2 years.
Oh, we met in the middle. This is why we're dating.
The Asthma and Allergy Foundation of America. AFA.
I would think it would be like the pillow companies. You need to throw away a pillow every year.
Well, they would say more often, right?
Yeah, that's why I said every year.
Totally true. They would say more often. That's very interesting. It says we can have mold, dander,
Yeah, the dust mite one is gross.
dust mites.
Yeah.
That's good stuff. I change my pillows all the time. I'm a big. I think the pillow, the mattress. I think mattresses. I'm not even going cleanly. I'm going to say, like, as far as investments go, I've spent so much money on a mattress. I spent more on a mattress than
I drink this shit.
I spent more on a mattress than I spent to find out I had to take a shit. $5,000.
It's worth it. It's so worth it.
'Cause you're on it
We have
every
the same
night.
mattress and I love it. Every night
do.
it affects your life so much. If you think about it, on average, we like people to sleep 7 to 8 hours a night.
When I'm depressed, I
Let's
sleep
just
20.
Well, that's true, but that's not funny. So 8 hours a night on average. I'm just going to round up so make it easy. So 33% of our lives are spent asleep. Why wouldn't you want to maximize your comfort if financially you can?
But here's
I understand a $5,000 mattress is a huge deal for a ton of people. So I think we're very fortunate that we can afford that. But I've cut down on a lot of other stuff to afford the mattress.
Now here's why I even brought this up to you.
What?
Think about the pillow.
Oh my gosh.
Think about the pillow.
I'm thinking about. I just
Are
gotta
you still
psych
drinking
myself.
your
Yeah,
thing?
I gotta psych myself up for this. I still have like half
Okay.
a bottle.
We don't have video on this one. I don't think so. That's why I'm doing play by play when you make your
It's
noises.
gonna taste so bad.
Yeah. We
The
will
last time
have
when you were
audio
talking and
of
I
you
went,
shitting.
ugh, I wasn't faking that. That was
Yeah.
me really dry heaving.
So the reason I brought that up is I think oftentimes think about mattresses and we spend all this time. You know what else you spend a third of your life on, Erika? What else do you put a third of your life on if it's a mattress? Your pillow. And your head's on it. And so that's why I'm arguing, why don't we spend a little bit more money on our pillows like we do on our mattresses? It's your head is on this for a third. I think everybody kind of goes like, hey, I've spent so much time in this bed. I'm going to get a good mattress. Maybe they don't. But I think that the pillow doesn't get enough recognition. And that's why I always get myself a nice pillow.
I think what bothers me is hotels and how many times they probably change out their pillows. Probably not frequently. There's probably dust mites and other nasty things. But I have a big problem. You know what I hate about the hotels? Almost all of them
What?
have those duvet covers, like the feather quilt things.
Yeah, I'm not
And they put
familiar
a
with
sheet-
a duvet. What is a duvet cover?
Well, no, a duvet. Sorry.
What's a
quilted-
duvet?
It's what you have on your bed and on mine. The fluffy white thing.
The fluffy what?
The
It's
one
not a
filled with
comforter.
down. Yeah, it is. It's like a down comforter.
It is a down comforter. Okay.
So but the hotels, they don't have a cover over it. They put a sheet down and they put another sheet on top of it. And
Yeah.
do they ever stay together? No, they peel off. So we're touching a duvet that has to be dry cleaned because of the feather or the synthetic material. They're not dry cleaning all of them. So we're touching a cover that has not been washed by how many people?
You know what's even worse?
So gross.
You know what's even worse?
The carpet in here?
No, I was going to say about that specifically. We're at a casino in Reno. There's probably semen and tears and blood. The things that have happened before people came back to this room in a city like this. It's I don't even know what to say. I feel like if we turned in the duvet to the police station, we would solve a couple cold cases.
Now I have to throw up more than I have to poop.
Listen, this went by fast.
Gross.
You know what I did, and I apologize?
I'm like looking at the bed right now in disgust.
Dr. Erika, we will report on whether or not your thing works. If you have bowel movement, we'll keep people up to date. I know they're curious.
Awesome.
At the beginning of this episode, I said some weird stuff about drinking. I don't even know if I specified that that's what I was talking about how I don't drink. And we never got to it. So next time, I'm afraid to ask, I think we should... what is this?
I think it's a lot of pressure when you go to your doctor.
I thought I played just the first two sets. I wasn't supposed to.
I think it's a lot of pressure when you go to your doctor to just talk about like your concerns, and they try to throw it back in your face, and they say like, "Do you drink? Yes. How many drinks do you have a week? I don't know. Do you drink every day? How many drinks do you drink every day?" It feels very judgmental, and it feels like, is there a magic number? If I say like 16, I'm okay. But if I say 27, you're like, oh, okay.
I told my doctor I drink like 5 days a week one time, and he said he didn't say anything about it. He just like wrote it down and looked the other way and didn't say anything.
So we stole this question from someone you were FaceTiming with, and maybe we could discuss it next time.
I do want to talk about it because I do have a magic number. But hold that thought because I'm going to go poop.
And I'm going to go pee. I'm going to go give a urine
Match made in
sample.
heaven.
All right. Coming up on the next episode of Afraid to Ask. I was going to say, can two people come out of the honeymoon period at different times?
Of course they do. I find that it's very rare when it's simultaneous, unless it's like a major event that causes them both to go, whoa. Like maybe they both get extensive food poisoning, Montezuma's revenge, and they're like barfing and having diarrhea at the same time on vacation, only one toilet. Well, that honeymoon phase ends quickly.
Well, I lied to you about something.
What did you lie to me about?
I just completely lied to you.
You're not in the honeymoon phase either?
No, I am, and I pretended I wasn't to fit in.
Was that the lie?
Yep.
Oh, you lied that you're not in it, but you are in it.
Yeah, like you were like, oh, isn't it crazy how now our chewing annoys each other? And I was like, yeah, God, it's so annoying. And I hear you chewing. I'm like, oh, that's the person I love chewing. It doesn't bother me. It only bothers you. I lied to you. It doesn't bother me at all. Nothing bothers me.
I'm excited to talk about this, though, because I actually think it's better to be out of the honeymoon phase, but I think there's positives and negatives to both.
I agree.